so I assume you live with your mom, your dad, and your siblings, right? He just went downstairs to get some coffee, huh? So tell me about your relationship with him. I bet he is so supportive of you. So is your dad in the picture? I assume you guys live separately, right? Did he abandon you guys when you were younger? Do you see him much, or is he incarcerated?
They want to talk about Black incompetence. I want to talk about the fact that I had significant medical concerns over the last 2 years that required me to see way too many medical doctors who all wrote me off as a psychiatric patient with anxiety. 8 total providers, 4 of which were white males, 0 of which were Black providers to be exact. And do you know which doctor was that decided to get on board without hesitation, without second thought, and listen to what I had to say and believe what I had to say and determine that I actually need brain surgery? That would be the 9th provider that I saw, who also happens to be a Black female neurosurgeon. It's not Black incompetence that's at play here.
No, I do not have a uterus. And I found all that out, later going to another physician. Oh, you don't have a uterus. Oh, that's what he did. Okay.
What kinds of treatment or medical procedures did you receive from him?
He gave me multiple annual examinations. He gave me a DNC that led me to believe that I needed emergency surgery, which led to a hysterectomy.
So you received an unnecessary hysterectomy from him?
Correct.
What happened after that?
What happened after that, I immediately, early 30s, went into straight menopause. Night sweats, hormonal mood swings, just feeling depressed, and I lost my husband. So when you think about starting over, I don't have that option to do so if I wanted to. I went in for him. I did complain that I had stomach issues that I later found out was just a hernia.
So here's something wild that a lot of people don't know about medical training. When we're presenting on rounds, we're supposed to, introduce the patient, say what's going on with the patient, like what we think is happening, what we think should be done. And for whatever reason, the race of the patient is kind of trained to be included in this presentation. Now, a lot of people say, oh, well, Black patients and white patients have different, like predispositions towards certain illnesses or conditions, so you have to be aware of that. There's so many other demographic differences that we don't point out. So for some reason, we're taught to say, so-and-so is a 15-year-old Black boy who is blah, 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 or a 43-year-old African-American woman who has blah, 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 blah. We don't say that with white usually. We don't usually say Caucasian. White is like the default. Very few people question that because it's just what we're taught to do. I think it's very weird because what are you getting at? What additional thing am I supposed to be gleaning from you telling me specifically that the person is African American? Is that supposed to prepare me for entering their room? Is that supposed to, make me think that they're more likely to have certain other problems or, personality flaws? Or I just don't get what we're getting at there. And yet, year after year, that continues to be the case on rounds in the hospital. You can listen for it. And if you are a resident or trainee or student or something and you're interested in helping us do a little bit of research in this area of implicit bias in medical training, comment or DM me.
Racism in healthcare definitely exists. And if anyone tells you it does not, they are a liar. And my daughter just experienced it for the first time today. I cannot tell you how many times I have been called to a patient room because, one, either the patient feels like the nurse that is African American is incompetent and does not know what they are doing, or 2, they just do not want an African American nurse for no reason at all. I also cannot tell you the amount of times I have had to chastise or reprimand a white nurse because they are not giving an African American patient the exact same treatment or care that they would give a white patient. So my daughter is doing clinicals, and she went in today to do an echo scan on a patient. This patient, she said, was in her early 90s, white patient. The patient had her daughter in the room with her. My daughter is biracial. So to the world, of course, she is perceived as African American. They went in to do the scan. The daughter and the mother immediately looked at my daughter and told the preceptor, my daughter's preceptor, who is white, that they did not want my daughter to do the scan. They did not want my daughter to touch their mother, her mother. The preceptor said, I'm not sure what is the problem. She's very competent. I am right here. If anything, is done wrong, I can correct her. The daughter proceeded to say she did not care. She did not want my daughter to do the scan. She did not trust it. She did not want my daughter to touch her. The preceptor pushed her for what was the problem. The daughter finally admitted it's because she's African American. She does not want her touching her mother. She does not feel like she is competent enough to do the job. My daughter looked at the preceptor. The preceptor again advocated that she's very competent, that she's right here overseeing. The daughter insisted she didn't want her to touch her. The preceptor said, it's fine, I'll do it. My daughter stepped out of the room. She did not get disrespectful. She actually went to the car and called me. She was in tears. She was so upset. Now, my daughter is a lot like me. My daughter actually wanted to go the fuck off. But because she knows she is a professional in a professional setting, she walked out and she came to call me. As a mother, I am pissed. I am just totally pissed off that my daughter was treated like that. But as a person who has worked in healthcare for many years, I'm disgusted. I am disgusted that people are this fucking ignorant in 2024. My daughter is very competent, and there are thousands and hundreds and millions of African American healthcare givers that are extremely competent. Some that are far more competent than their white counterparts. But ignorant ass patients like this and their families will never get to experience these wonderful healthcare workers because their fucking mindset is so stupid. And I hate that my daughter had to go through this. I am truly disturbed. But it's the reality of the world we live in. That people are just this fucking stupid.
Hey friends, this is Dr. Wes Ely from Vanderbilt University. And I just wanted to talk a bit about racism and race in medicine and errors we've made along the way. I think this is an important topic because there are things that people have been taught, like me earlier when I didn't have gray hair, about the science of race in medicine that are all wrong. And I'm going to give you three quick examples today. One is related to lung function, two related to kidney function, and three related to the color of our skin and how we get wrong measurements when we measure oxygen levels, for example, during COVID. So first off, regarding lung function, for decades, we have been adjusting people's lung function measurements in our pulmonary labs based on the color of skin. And it has no scientific basis. It's all just stemming from racist thoughts about differences between white and black lung function. We need to get rid of those adjustments because they aren't real. Secondly, kidney function. We've done the same thing with kidney function where when we measure how well somebody's kidneys are working, we have been taught to adjust for color of skin, and we now have disproven that in science. And yet some people still use these measurements around the world, making mistakes in adjusting how people's kidneys or measuring how people's kidneys work. And the third one, the most relevant to the COVID pandemic, is that the pulse oximeter, which we put on our finger to measure our oxygen levels, is affected by skin pigmentation. And we actually have a report now of over 125,000 readings of pulse oximeters showing that people with dark skin actually get an overread on what their pulse ox says. So that, for example, if they got into COVID pneumonia, came in the ER to get their oxygen levels measured, the pulse ox would read falsely high. It would overestimate their levels. So if they came in and had a level of 92, 93%, I would be lulled into thinking that they were normal when in truth, their level could be like 88%, 87, something dangerously low. So I have to know that, and you need to know that, so that if you're getting your oxygen levels measured with a pulse ox and you have dark skin, that we can use, for example, a blood draw to measure that more accurately and understand if different therapies are needed for somebody with COVID if they have dark skin and we've misrepresented what their oxygen levels are. All these things are, I think, critical issues for us to consider when we're trying to rid the world of racism and especially the world of medicine. There's no place for it in the world of medicine. Let's all stay together on this. And thank you so much. Bye-bye.
I just experienced the exact reason why people don't go to the doctor, especially black people. So I go to my dermatologist because I've been experiencing little dry patches all over my body, and recently my skin is usually very clear, but I've had some texture on my chin, little areas where I just would like to improve. And my family has a history of skin concerns, so I'm trying to stay on it, okay? I'm trying to do the right thing, do what I'm supposed to do, and go to the doctor. That's it. So I book an appointment. They get me in fairly quickly. I guess I have a high deductible, so I had to pay $90 to see this doctor. Cool. I'm thinking I'm paying $90 to get my concerns addressed. I think that's what anybody would think, right? So I go in, I wait a minute. I'm waiting a minute, by the way. I get there early for my appointment. I'm fine. Okay, I'm a little early, but I'm still waiting about a half hour to 45 minutes before I even see the doctor, but whatever. So I go in, I sit down. The first lady comes in, asks me what my issues are, reviews my medication, you know, the normal stuff. I'm like, okay, you're going to see the doctor. I wait about 20 minutes before she even comes in to see me. She comes in, she's like, oh, you're having, you know, these dry patches on your body, whatever. I'm showing her the dry patches, whatever. She's like, oh, well, like, I'm thinking about doing this steroid for you or this cream for you or whatever, but because of your insurance, it's going to be $100 about a bottle and da-da-da-da. So first of all, the lady didn't even ask me if I wanted to pay the $100. If it's going to work for me, yeah, babe, I'll pay the $100. You didn't ask me. What you think I couldn't afford it? What was that about? Anyways, so she's like, oh, well, then I think we should try hydrocortisone, which I've been doing hydrocortisone already. Obviously, it hasn't been working, hence why I'm sitting in your face, ma'am. Hence why I'm sitting here. So she just writes me a little list here, a little list of everything she wants me to do. Buy some La Roche-Posay, get some more hydrocortisone, and use some Dove soap, which I already use. So she writes all that down, grabs her computer, and stands up. I'm like, well, wait a minute. I have like 2 other things that I want to talk to you about. She's like, oh, what is it? I'm like, you know, I've had some texture on my face, as you can see. Like, I want to get this cleared up. This has been an issue for me because my skin is usually clear 98% of the time. You know, I have a regimented skincare routine that I use that usually has my skin clear. She's like, oh, okay, well, we'll talk about that in 6 weeks. 6 weeks? Ma'am, you write me a fucking note. A note on a piece of paper and tell me to get some over-the-counter medicine. Don't even ask me or address my other concerns and tell me that you want me to see your ass in 6 weeks to address some shit I'm experiencing right now? And I gave you 90 of my dollars? I'm pissed because I left out of that appointment already thinking to myself, but you won't see me in 6 weeks. I don't want to come back because you showed me that you don't even want to listen to me. You don't even want to listen and be a doctor and address what I came here for, was to address all of my concerns. Why the fuck do I have to make another appointment in 6 weeks to talk about something that I'm experiencing right now? That's absolutely ridiculous, and it makes sense why people don't even want to go to the doctor. Why would I go to the doctor and tell somebody what something is going on with me for you not to even help me? For you not to even use your fucking degree to help me do and fix the problems that I'm having right now. I'm thoroughly upset. And it's like everything has come down and boiled down to just being a fucking money grab. You want to see me in 6 weeks so you can get another $90 out of me to address only one of my concerns and then push on and act like you just did something oh so miraculous. That was a waste of my fucking time. It was a waste of my fucking time, and I'm pissed. And luckily for me, I will just go and find a new dermatologist because obviously I just don't think you're a good doctor for me, and hopefully find a black doctor that will actually listen to my concerns and make me feel like I'm in more of a safe place and actually is listening to me, because that was absolutely ridiculous. Because I know anyone else probably leaving feeling pissed and unheard the way I did wouldn't come back ever to a dermatologist. Black people barely even believe in dermatologists. So I'm trying to do the right thing and then I get dismissed. Thank you for listening to my TED Talk.
How long? I've been hearing that for hours.
Like I just said, we'll have someone come see you in just
And like I just said, I've been hearing that since 11:30.
Okay, so you can argue with me?
Or you can give me some help. Because that's what you're supposed to be here for, right? And ain't nobody helped me yet. I have an abscess going down my throat. Ain't nobody took my blood pressure. Ain't nobody checked my vitals. Ain't nobody did nothing.
And her doing all of this is causing even more
And I have high
distress.
blood pressure. I have not ate in 3 days. I need help. Pam ain't no damn help.
I'm not going to yell at somebody.
He said he not finna yell back and forth. We'll get up like a professional and come de-escalate the situation. I don't care if you see it. I'll put it in your face, on your shirt, or whatever you want. Like, okay, have security come by, because you're not finna violate my First Amendment at all. I have constitutional rights that supersede any state law you trying to enforce. Your policies aren't overriding my constitutional right. Simple. I do, actually. I do. I don't need your consent in a public government building, sir. This is a public government building. I'm not recording no patients. Why don't y'all feel comfortable being recorded? Because y'all know y'all being negligent? I'm not being negligent. So if you're not even tending to that patient, why are you talking to me? Y'all don't have the right to delay care. Y'all don't have the right to be dismissive towards a patient in distress. Y'all have not checked no protein levels. She came here for emergency surgery, sir, and has not even received that. Okay. But you worried about somebody recording instead of somebody's airway being obstructed.
She's not my patient.
Right, so why are you even talking? Why are you talking?
Because I am allowed to talk.
Okay, then I'm allowed to record.
No, you're not.
All right.
It's against hospital policy.
Hospital policy, not my constitutional rights, sir.
She can leave. She's Spanish. She can leave.
Okay, I'm not going to tell you that right now. Pam, you already upset because I was challenging you on shit. Sir.
Listen to them. I'm trying to talk.
Okay.
So, they don't allow the recording. It's
Why?
against, hospital policy.
Right, because it exposes their negligence, right? Right, so y'all try to enforce policies that infringe on people's rights.
Okay.
So your policy does not override my constitutional right to the freedom of press. In a public, you a government,
Don't listen to
tell him that. Tell him, sir, let me talk to her. Thank you. Right. Because y'all always try to.
I got you.
Thank you.
But nah, listen.
I'm documenting for my own safety.
I get that. But now they want you to leave.
They want me to leave because I'm questioning about their lack of care.
Okay.
That's against the law as well.
I understand. But they want you to
And
leave. And if you don't, we'll have to get the police involved for trespassing. And I don't want to do that with you.
okay, and then when y'all do all of that, y'all gonna be liable for a lawsuit. So either way it go, y'all can keep avoiding accountability.
Right.
They can keep trying to paint me out to be the aggressive, angry black person when I'm questioning the care of my sister that's sitting here with a airway obstruction, sir. Right. And you telling me that I can't document after I've asked pretty much every staff in here to document the delay? So I can't document on my own?
You cannot be recording.
I need to see y'all policy that states that.
There's actually...
He said it's a policy. I would like to see it.
So especially back here, because there are patients that are in the hallways.
Right, y'all shouldn't have patients in the hallway. How inhumane is that? And then they got the glory boys waiting for me. Y'all ready to do our dance? I'm ready. I told y'all.
So if they don't want you recording back here,
I want to see the policy. Can you give me the policy?
I don't have the policy.
Well, I'm requesting the policy.
Okay, I don't have to bring in the policy if they tell you that's a policy.
But that's
It says taking photos or recording
that's
videos
that is a
violates the right of others and is prohibited.
that is a piece of paper printout.
That's the part.
Y'all should have y'all policies in a organized manner, not just plastered up there. Anybody could have typed that up on a computer and printed it off.
Well, that's what they do with the policies anyway. That's going to be the same thing that.
Policies are actually put in books like with the other policies. So where's the rest of the policies? Show me that policy in the policy.
So it's the same thing.
So y'all,
Here's the deal.
it's
I'm not
arbitrary
trying
then.
to-
Y'all
I'm
just
not
making
trying
up
to-
rules as you
If you want
go.
to document things, you actually can type it on your phone. You can keep notes of it on your phone.
Or I can ask medical care providers to document.
Come on, I need to know what's the hold up on the doctor. This is my sister, and I want her here with me.
Okay, they don't want me to.
Well, because we want to make sure we're doing the right thing for your wife, but we haven't been able
By getting
to.
security? What is security going to do with my wife? And I'm trying to get her out here to a specialist. What is security going to do?
Okay, well, we have everything in the letter.
What's her name?
So we will.
Wait, what's your name, ma'am?
What's the point? I mean,
Ma'am, what's your name?
This is a continued.
What's her name, Dad?
Who are you?
Yeah.
Lisa.
Oh, Lisa. Yeah. Who can I use to file against you? Who can I complain against you?
Oh, we already received it.
No, I said, who can I complain against you? If I have a complaint against you, who can I talk to? So I can write that down. If I have an issue with the patient's advocate, who can I call?
Transfer out of this hospital.
I'm asking you a question.
Okay, I'm listening to your father.
Okay, I'm asking you, who can I complain to when the patient
You already
advocate?
did.
No, who can I complain to? Who can I complain to?
Commissioner, we'll file a complaint because basically she's trying to provoke.
Yeah.
Sir, I'm not.
Yes, you are.
And her provoking.
Yes.
I'm really trying to request for my wife to go
Yes.
see a specialist.
Yes.
Because you guys are not going according to my request. You're sending in security guards. You're giving me bogus letters that's not accurate. And nobody, everybody.
And the patient advocate is not advocating for us, because look, see how they calling security on us? My mom is sitting right here. My mom is sitting right here unattended for, and patient advocate is bringing security with us. Is this advocating for the patient? This is my mom. She cannot speak, and then she's bringing security up in here. Today is August the 16th, 2024, and you saw what the patient advocate did. The patient advocate is coming up to our room, harassing us on this floor, and that's what they're doing. They're harassing us in the hospital. We're in the hospital trying to get some stuff taken care of. That's it. Most High is good in heaven. The Most High in heaven is really good. And my mom, she's 67 years old. My mom is 67 years old, and the patient advocate is not advocating for my mom. She's 67 years old and can't even speak, and there she's for the hospital. And I never got a chance to complain. But it's all right, just like the Father told the children of Israel when they were in Egypt to let his people go. And it took some time for Aaron and Moses to reconcile the differences that the taskmasters in Egypt was doing against the children. And he was able to see those burdens that they were putting on his family, a family of God, And that's what that is. It's all right. The Most High is good. He reigns on the just and the unjust. But you saw that. You saw how the patient advocate came in with security. My mom and my dad is 67 years old. My mom and my dad is 67 years old. They're elders. These are elders. And this is the hospital that they brought my parents to. That's why we wanted to transfer so we can go to a place. We've been dealing with civil rights and all of this, of our rights being violated. And here we are in 2023, and we still are being met with discrimination. Us as Israelites, all we wanted was the standard of care. That's it. And the patient advocate is not even advocating for us. She never came to us and asked us what we needed or anything. The hospital is using her and security to mess with us, and that's not right. But that's all right. No weapon that's formed against us shall prosper. Every tongue that rises up against us in judgment we shall condemn. This is the heritage of the saints. This is Isaiah 54:17. And that's not right. That's not right for them. We tried to get the CEO and Jennifer and the administrators to talk to us in regards to what's going on to Laura Roberts and 404, but they don't want to do it. See, that's what the patient advocate has done. And my parents, they grew up in the 50s and the 60s. They seen this. And here I am. I have to see it now myself. We're not progressing. We're in 2023. We're not even progressing. They got my own people in uniform treating us like we're criminals and we're in a hospital. There's no patience that is being met with this type of opposition. My dad is 67 years old. He's an elder. And that's not right. That's not right at all. And I want this hospital to be exposed for the things that they're doing against my parents and unrighteousness. My mom is 67 years old. She had 2 strokes on July 25th. And ever since they brought us in here,
We've had people like Milton want us out, tell us to get out of here. She wasn't even here for a day and put in a transfer. And we just want everybody to look to see what's going on instead of harassing us. This is a hospital. But hey, what do you expect? What do you expect from a people who don't serve God? What do you expect for a people that's ungodly and don't know the truth, but they're full of hatred and evil? That's evil for the patient advocate to approach my dad. My mom had 2 strokes, and we don't even know why, and she's laying there. And all we ask for is a doctor to come in and explain to us what happened to her brain, why you didn't feed her, why you messed with her feeding tube. My mom didn't eat for 5 days. They put a tube in her nose, and they put it in correctly. So they think they can use security to intimidate us, to not even hear what we're saying, to address our concerns. That's why I said I want to file a complaint against the patient advocate, because the patient advocate is not listening to us. She's working for the hospital and having security, my own people, come against me. And all we want, we're not violent people. We're peaceful people. We're the children of God. God said we got to be peacemakers. And it's not right that they're having my people do this in uniform, but I know this is his job. He got to do his job. Okay, you got to go. Okay, right. Okay, then go ahead and take care of your business. I'm glad you handled yourself right. The patient advocate did not advocate for you. She got the security. What? Messing with my dad and my mom. 67 years old. But Father, you see this day. Today is August, 16th, 2023. On a Wednesday. My parents do not deserve this. But how can Satan cast out Satan? His kingdom won't stand. But it's all right, Father. You see this day. And I pray, Father, that you visit this hospital and let your mighty hand see the unrighteousness that's happening. Security guards, they got security guards on us. Patient advocate is harassing my dad. That's harassment. All because my dad wants to...
I'm pregnant. I'm a black woman. I go into labor with my baby. They tell me what's going to happen. Baby comes, baby's premature. I breastfeed my children. Shocking, right? Because apparently black women don't do that. But here's what I will tell you. This is where the systematic racism comes into play. Not being called the N-word, but literal systematic racism. They come in and tell me, we cannot give your daughter your breast milk because we found drugs in your system. I say, well, that's impossible because I don't do drugs. They say it was marijuana. I say that is also impossible because I don't smoke marijuana. They say, well, we found it in your milk and we cannot give her your milk. We're going to give her this formula. We need you to sign a paper for this formula we're going to give her. I say, fresh out of surgery, might I add, C-section, having these conversations. Daughter is 1 pound. I'm stressed out. They're telling me I'm a drug addict. Don't do drugs. So they then come in, a bunch of white women come in and say, well, do you eat lemon poppy seed? No, I don't. Actually, I'm actually vegan and I don't do any drugs. They then say, well, maybe your neighbors gave you some brownies. Maybe your neighbors made some brownies and it had weed in it and you didn't know. I say, I live in a community of people who don't make weed brownies. It's a 4-bedroom, 2-bath house, over 2,000 square feet, 2-car garage. I don't smoke marijuana or eat marijuana brownies. They say, well, we found it in there. I said it couldn't be mine. So now I am fresh out of surgery from being cut open on my stomach, being told by all of these white women that I live in a community that makes brownies and drugs me, right? Like I'm being drugged by my neighbors unknowingly, and I'm also doing drugs while pregnant. This is all being told to me fresh out of being cut open with a child that's 1 pound. Don't know if she's going to survive. No medical care or attention. It took for the hospital, the president of the hospital, to be called demanding to retest my milk or there's going to be a lawsuit. I am post-surgery, guys. Not even 2 hours, let alone 12. Okay? I'm post-surgery and I have to advocate for my child, my black daughter, to drink her black mother's breast milk because I'm being gaslit this whole time so that and here's the kicker. What actually happened is they wanted to test a formula out on my daughter. And if you don't know this, trials and tests and studies are done a lot on black babies, because unknowingly they think that black people are uneducated, and they get you in a state where you are in survival mode and you don't take a second to pause and think and make an informed decision. So they thought the likelihood of me being a black woman and smoking weed while pregnant was high based on statistics. Well, guess what? They tested my milk, and the demand was, you need to retest the same milk. You need to retest it. And guess what? There was no marijuana. And my daughter got to drink breast milk. I'm saying all that to say, when we think about systematic oppression, we do not understand how deep it runs. We do not understand that there is a literal attack on a black woman, especially when she's in medical care. So I don't want to hear all of this talking. And this is why I'm very loud when I say lower your tone. I'm not talking about you denying me or calling me the N-word. I'm saying that you are actively sit in a system that works against my people. And I'm not going to shut up about it, because I know what it means to be systematically oppressed, experience systematic racism. Less than 2 hours after being cut open and having a baby that's 1 pound. I know that. And I have stories like that for days. So all of this yapping about it was old, slavery was this. Slavery is not the only issue that black Americans went through in this country. Okay? We know the date slavery started and the day it ended. And it hasn't stopped white people from being systematically oppressive towards my people. So I don't want to hear it. Okay? Lower your tone. I'm always going to be nervous when Caucasians are afoot. That's just me. I have a podcast, so if you like that story, make sure you go click the link in my bio and check it out. I'm talking to you. I'm talking to me too. Spotify, Apple, Google, Danielle to you, everywhere you could think of, okay? Story time on how